Hello everyone and welcome to this video. I apologize for the long wait, but 2020 has been a crazy year, as you all guys know. In today's video I'm going to talk about diabetes. So let's begin by talking about insulin. So let's pull out an image of human body, kind of like highlighting the main organs we're interested in this case. In this case, the main organ we're going to talk about is the pancreas. So if we get a little pen, I'm not sure if you guys can see it, but let me try highlight it. Maybe red is not the best color, but if we zoom in a little bit, let's do it like this, and maybe take another image that gives a bit more better picture about the pancreas. So that's massive, and just move everything to the right. So you can kind of like see a little bit how the pancreas. So the pancreas contains specialized cells, which are the islet cells, which produce insulin, which is a hormone that allow you to process and digest and basically regulate carbohydrates, proteins, and fats, which ultimately increase the uptake of glucose, which is very important in diabetes. So let's talk about diabetes type 1. Diabetes. How's it? Diabetes. Sorry, my writing is awful, but I don't know why. Okay. And what happens in diabetes type 1 is that the pancreas does not make enough insulin. So shall we say just not enough insulin. Or sometimes there's not enough, it just doesn't make it at all, so none produced. Okay, so that's the first point that you should know as a PA. And obviously the risk factor can be genetic, so genetic causes, or environmental. Another thing to be aware as a PA, that generally, people are diagnosed at a young age. So it was also called juvenile diabetes. So we put early diagnosis. So those are the main things you should kind of know as a PA. So next thing to know is obviously the symptoms. So if we carry on with this, let's write here. Let's zoom out a little bit. Symptoms. So what are the main symptoms? And this is something you see very much if you work in a GP practice. Polyuria, which is increased urination or frequency of urination. Okay. And Polydypsia, which is increased thirst. Dypsia, more thirsty, but yet they still feel dehydrated. Ironically enough, one of the main thing they present in GP is actually weight loss, which is obviously non-specific, but just be aware of that. Or nausea, lethargy, and if I have to say the truth, they often present to the clinic or in secondary care with symptoms of DKA or diabetic keto acidosis, which we will cover later on in the video with more details. So let me just write present often with DKA. So at this point as a PA, if you see this patient and you are suspecting diabetes and they're symptomatic, as we say, you ought to do a quick prick test or blood glucose prick test. And if their sugar levels are above 11.1 millimole per liter, this is basically you're confirming that they've got diabetes. So let's just tick it. Yeah, right. If they're not symptomatic, if not symptomatic, you have to repeat it or send some blood test. It's up to you. Obviously, if they're not in decay, which is a whole ball game. So these are where we are at the moment. So how would management go? So let's find a little spot here and choose the red pen again. So let's just call this management. Just put that there. Just get rid of this dot and choose the blue color. So management mainly involve preventing hypos. So we want to obviously this is done through a multidisciplinary team. Okay, so you want to prevent hypos or hyper glycemia, which is very important. Obviously hypos being more of an emergency because they can go into a comatose state where they're not responding. You need to give them glucagon if they're still kind of there, or give them an injection of glucose. Or if they're hyperglycemic, we know that it can cause damage to the eyes and organs. However, the main thing that all diabetes type 1, let's just say type 1, let me just cancel that, that's not very good. All diabetes type 1 require insulin, which is a synthetic form of insulin, which we spoke about, which are produced by the specialized cells in the pancreas. I'm trying to not go into much details because you just need to know the main things as a PA. Okay, and obviously the patient should be monitored. Okay, the main organs, hands, foot, eyes, monitoring. It's also very important because you obviously want to see if there's any ulcer developing. Okay, and as I mentioned before, this is mainly done through a diabetes specialist. Most of them will have the diabetes specialist nurse, or a specialist that is following the patient. Specialist. Alright, thank you guys for watching this video. I know it doesn't cover everything in detail, but this is just to help you a little bit for your nationals. Don't forget to like and subscribe to my channel, and leave a comment below if you have any questions, any query. And the next video I'm going to cover the topic of type 2 diabetes. So see you guys in the next one. Goodbye.